Okay, hi everybody. Does anybody want to chime in and say hello? Let us know who's here. Okay, well, people are usually a little bit late starting these things up. So I'm just going to give a couple minutes for a few more people to join us, and then we'll get started. Today, just talking about thyroid function. Hi, Leslie. Thanks for piping in. I know you guys are there now. All right, great. All right. Well, thanks, everybody. I am Dr. Lori Brouwer. I have been with the Living Wellness Medical Center for a few years now. And today I just want to talk to you a little bit about thyroid, how our thyroid is supposed to function, what kind of things can show up in our bodies if our thyroid is off, and different ways that we can make sure that it's working optimally. So, thyroid function. Let me just go ahead and start my slides. And I'll mention again at the end, but I'm doing the slide presentation for you all today, but there will also be a handout that's going to follow this. We'll email it out to all the participants later. So go ahead and, take any notes you want and ask questions as we get to the chat. And in the meantime, just, let me know if you have questions. All right, so the first thing we're going to talk about is really generally, I just like to review naturopathic principles before I talk about any health conditions, because we always want to stay rooted in our naturopathic philosophy, and that we are more than just a physical body. We are a spirit, a body, we have cognition and thinking. So all of this, of course, plays together to make us who we are. The conditions for health, we always want to observe that we are, following along with the natural conditions for health and the way that our bodies either evolved or were created. The way that humans have lived on this earth for the majority of the time was nothing like the conditions that we live under now, right? We have artificial light day and night. We're not following, eating seasonally or anything in touch with nature. So we always want to make sure when we're looking at any kind of health concern that we have first steps first. Are we staying as aligned with natural living as we possibly can? Meaning these things that are on your screen here, eating whole foods, drinking pure water, following light cues as best we can, trying to stay darker in our houses at night before we go to sleep. Of course, always important to move your bodies, physical exercise, so many benefits to that. We'll get into that later too. But, social interactions, I'm sure we're all feeling this now, having limited social interactions. It's, affecting our health. So next slide. How do we maintain our balance to stay kind of living aligned with how our bodies work best? And that's to always manage, the good things that are coming in and the trash, take it out. Our bodies have an amazing ability to reach homeostasis or a balance point as long as we're just giving them what they need and not getting too much in the way. So different things you can obviously read on the screen here, but modalities that we use in naturopathic medicine very often are going to be involving, what kind of nutrition are you getting? How much movement are you getting? Do we need to add some herbs that may be beneficial for a period of time? So there are definitely things we can do as your naturopathic doctor to help, recommend things that you can do at home. But so much of this work of keeping our thyroids healthy it's just an inside job. Let's see. This is something that's really important as a naturopathic doctor. We learned this in our medical school training, and really is the therapeutic order. And this is something that is the order in which we want to try to treat any issues, right? So the first thing, say you come in and you're feeling tired, which is mostly what comes with low thyroid. So we want to evaluate your symptoms and how you're feeling. And when we start to do the treatment, if anything is needed, the first thing we do is identify what's the obstacle to your getting better. And if with, say, your thyroid is not functioning well, and we want to remove an obstacle that's stopping that, it may be that you're not getting enough sleep and your body is intentionally lowering your thyroid set point. So in that case, the obstacle to cure is get you sleeping better, and then your body can correct itself. But we always want to start with those types of interventions at the top, really reserving things like adding supplements, adding medicine, or doing any kind of surgeries and things like that. Those are always going to be way lower on the list. Now, where thyroid optimization fits into this order, a lot of the things that we can see, they're highlighted in red. These are specific things that can be impacted with thyroid function. It may be that you're not getting the right nutrients, so we need that healthful regimen of your diet to be improved. Maybe you live in an area that used to be agricultural land, right? There's a lot of pesticides and things left over in the soil and the water near you. So you may be, toxicities. Maybe you've got household cleaning products, or you wear perfumes and lotions, or you have things in your environment that are toxic and injuring your thyroid gland. So, there are a lot of different things that we can look at, but these are sort of the main ones when we're talking about thyroid. All right, let's just get into the nitty gritty of your thyroid in case we're starting at the very basics for some of you. What is it? It's a gland that sits right here in your throat, right on either side of your voice box, and it generates thyroid hormones for you. It's it's a gland. It makes hormones, and the hormones that it makes are T4 and T3. T3 is the one that we really focus in on when we're looking to see if your levels are adequate, or if we're trying to figure out, why you're feeling fatigued or sluggish, or, gaining weight too easily. T3 is the big, powerful one, but T4 is really important too. And that one is more stimulating for brain energy. So we want to look at both of these hormones, not just one. And you can see, if you look at the little graphics down there, those little chemical graphics down at the bottom, T4 and T3. Now, I bet if you're looking at that just cursory glance, you can't see that those are slightly different. They are. T4 and T3 have a tiny little change, and that's one less little iodine off the side of the T4. That allows that hormone to cross the blood-brain barrier and energize your brain, where the T3, because it's lacking that little extra iodine, it can't cross that barrier. So you can see that these hormones, even though they're incredibly similar, they have enough of a difference that they function differently inside of our bodies. And that's important to remember about hormones generally, is one tiny little conformational change in that chemical shape will change the way that that thing functions, which, not to get too deep in the woods with hormones, but when we do bioidentical hormone replacement, this is why it's very important to get bioidentical hormones that exactly match these, and not a chemical substitute, because they just act differently in our bodies. So, and, again, bare bones basics about this. What is a hormone anyway? It is just a chemical messenger that transports a signal from one cell to the other. Say we make the thyroid hormone in our thyroid gland, then it travels through our bloodstream and it tells all the cells of our body what to do. So it's just a widespread little messenger. What is it good for? What's thyroid all about? It is a stimulator of every function in our body. Really, we need thyroid to stimulate our bodies into action. So when you think of your metabolic rate, resting metabolic rate or basal metabolic rate is the energy that we're using just sitting at rest, right? Running our liver, our heart, our intestines, just keeping our body working. That's the basal metabolic rate. And that's definitely what T3 is supporting. So when people say, oh, I have a sluggish metabolism or a very fast metabolism, oftentimes what they're talking about, or what's causing that to be the case, is how much thyroid hormone they have available to stimulate that activity. I hope this is all making sense to you. Pipe in or raise a hand if you have a question. Other things really important. I mean, thyroid, every cell in your body needs it for something. In your brain, it's important not only to help the brain organ itself develop, but to make the neurotransmitters, which are the little signaling molecules within the nervous system itself. Also, just that electrical signal passing across and along those nerves requires thyroid to stimulate that. So, thinking is sluggish, reaction times are slower. Cognition is not so great when we don't have thyroid to help our brain. Digestion, this is a huge area. Oftentimes, one of the cues that somebody's got low thyroid function is that they are constipated. They're not having bowel movements at least one or two every day. So it's really common with low thyroid that we get constipated. But also assimilating nutrients and digesting foods down. Of course, our intestines need the stimulation from thyroid to do that function too. Body temperature is one I see commonly. If you are the person in the room that's always the first one to put on your sweater or your jacket, you're getting chilly, then it may be low thyroid. It's potential. So yeah, all growth, all development, very important that we have enough thyroid to help us do that. Now, as far as down at the bottom of the slide, you'll see the regulation of other molecules. So serotonin, what do we know about serotonin? Serotonin is a neurotransmitter in our brain and in our guts, and it is antidepressant, right? This is the target of a lot of antidepressant medications, is improving serotonin in our bodies. But what if you're depressed and your mood is low just because, serotonin is low because thyroid is low? So we don't always have to jump to taking a drug to regulate serotonin if we could make our own serotonin if we had, better thyroid. Also muscle tautness and the production of cholesterol, right? So many wide, varied things that our body controls using thyroid. All right. Where do we usually, what do you need to produce thyroid hormone? We need these particular nutrients. So really eating a wide variety of foods, making sure that you don't have a terribly limited diet so that you get nutrients from various sources. You can use, seafood tends to have a lot of these nutrients that we need. Iodine comes from the ocean, so seafood is going to have a lot of that. Selenium you can get from eating Brazil nuts. One Brazil nut a day has over the RDA for that nutrient, so you can very easily get that from diet. So really, and our bodies know how to get nutrients out of food, right? They know what to do with food. And so oftentimes eating food and getting our nutrition that way is superior to taking it as a supplement. So, we always want to make sure when you're in the office that we're talking about your diet, your nutrition. And of course, there is specialty testing that we can do, blood testing that can measure micronutrient levels. So we can actually see if you're deficient in these and, have a specific need to boost in your diet. So it's nice to know we have that kind of specialty testing that can get us that info. I told you that those hormones are just chemical messengers, and they're it's like for thyroid, they are generated in the thyroid, and then they go through the bloodstream, and that's how they're delivered to the cells. But once they get to the cell site, then the way that they interact with that cell is through this hormone receptor. As you can see here, it's that little blue thing that's on that's the wall of the cell that's in that graphic. And the yellow would be the hormone that goes and clicks into its receptor site, or that open part that's like a key and an ignition. And then it stimulates the cell, sends information into the nucleus, and then stuff happens. Whatever is required of that cell is going to just be stimulated by this thyroid tagging onto it. So one way we measure your thyroid is just to see how much is in your bloodstream. Is your body making enough of it? Do we see a lot of thyroid hormone circulating? Great. But if you're somebody whose cells, these receptors on your cells may not function really well, and the hormone may not be able to target the cell because there's a problem with that receptor. So even, this is very commonly the reason why patients will feel sluggish and tired and chilly and constipated and have thin hair and dry skin and brittle nails and the things that go along with low thyroid. They'll feel all these symptoms. They'll go to their general care practitioner. They'll run labs. They'll look at the levels in the blood and say, oh, this is your normal. Your thyroid is normal. It's not the end of the story. Just because it's circulating doesn't mean it's available for the cells to use if their receptors aren't functioning properly. So, we always don't want to always take it as the final answer when somebody says, well, your levels of hormones look fine, because your body still may not be using them and we need to adjust things. All right, symptoms of low thyroid. This may be what you all have been waiting to see and what you're familiar with. You may recognize these in yourself or in loved ones, but symptoms of low thyroid, generally speaking, are going to always involve some sluggishness, some low functioning activity. Anything, from being tired, like I said, dry skin, brittle hair. But, some really unusual things can occur when our thyroid is low, like having ringing in the ears or having muscle cramps or having joint pains. Really common when thyroid is low to have just generally achy joints and water retention. Everything in your body just functions slowly and poorly. So that's understandable. Special note here, yes, fibromyalgia is a condition where you may have plenty of that hormone running through the bloodstream, but if it's not getting into the cells because those receptors are resistant to it, oftentimes we get that fibromyalgia picture. Let's see. Okay, so we've seen how your thyroid is supposed to function, right? Certain nutrients allow it to make the thyroid hormones. It generates them and then it sends them out into the bloodstream. Then what can cause problems? What are some of the common issues that we see with thyroid function? And, globally, the number one reason for low thyroid, or what we call hypothyroidism, is an autoimmunity, where your body's immune system actually turns against yourself and starts attacking your thyroid gland and not allowing those hormones to be generated. So that's the most common cause. But in my practice, I've highlighted for you the number one cause I often see, and that's just unmanaged stress, because our hypothalamus in our brain, deep center of our brain, is always monitoring what's happening in the body, right? It's monitoring the environment, what's outside us, what's inside us. And when it senses there's a threat or excessive stress, there's something threatening the body, your hypothalamus will send a signal to your pituitary, which sends the signal to your thyroid gland that says, slow down production of thyroid hormone. This body is under threat. It's overly stressed. We're not going to have enough reserves to get us through this difficult time. So slow the metabolism down. It's a conservation method by a body that's under too much stress. It's very smart. I mean, it's a really wonderful adaptation, but we live in a world that is so overly stressed right now. And, really we have, since we implemented, electric lights in cars and on modern living. So this is really a big reason, is stress that hasn't been properly managed and eliminated. So it builds up in the body. That can interfere with thyroid function. Again, poor nutrition, not bringing in the micronutrients that you need for your thyroid gland to actually produce the hormones with. And then damage. Your thyroid gland is almost, I like to call it like a canary in the coal mine. This little gland is so sensitive to external environment and toxins and things that it really needs more protection in the form of antioxidants. They help to protect it from some damage. So antioxidants, they're the reason we want you to eat fruits and vegetables, right? It's one of the big things you get. Fruits and veggies have pigment, red apples, red, purple cabbage, blueberries, right? Foods with lots of pigment. Those pigments, those colors actually are the antioxidants. They actually contain the medicine for us. So more fruits and veggies, more colors, get your reds, oranges, yellows, greens, purples, like get all of those different colors every day. And you're going to be bringing in the antioxidants from those foods. But again, the caveat to that is without a good, healthy population of gut bacteria, we're not going to cleave those antioxidants out of that food and be able to absorb them. So it's really important that we have good, general, healthy gut function, which if you've ever worked with a naturopathic doctor before, we're going to tell you that's the core of everything. That is central to our health. Having a good, well-functioning digestive tract is key. And so making sure that we've got that going, we can absorb these antioxidants, then they can protect us. All right. Other things that can interfere with thyroid function, I'm assuming most of my audience is women, most of my patients are women, and particularly for us, there is deep within our brain, again, that prime directive to remain reproductive, right? The body always wants to, the brain always wants to keep the body in a state where it could reproduce. Our brain doesn't know that we're postmenopausal. It doesn't know that we don't have eggs, to do this function anymore. It still wants to keep the body within certain parameters that are healthy, and not overly taxed, right? So with exercise, certain types of exercise are overly taxing for the female body, and particularly it tanks our thyroid hormone. And that would be, things like marathon runners, half marathoners, people that do steady state cardio workouts where you're, like this says on the slide, greater than 65% of your max heart rate for more than 20 minutes. So jump on that treadmill and just run for an hour. You're not really doing yourself any favors when it comes to weight loss, because if you continually do that, your brain is going to reduce your metabolism to preserve your fat. That's what it wants to do. So how do we do exercise more efficiently? We do trick the body a little bit. We do high intensity intervals, right? So you do, a couple of minutes of really heavy, high cardio, and then do something that's a walking pace for about 3 times as long as the short pace, the short, fast pace. So interval training is better for females than steady state cardio. This has been seen quite a bit actually in people that were marathon or triathletes, women that did this high endurance kind of cardio workouts, and then they stop training and retire from that and suddenly gain a lot of weight. And it's because their body during the time of that high exercise reduced the metabolism down. And now when they go back to, normal activity, normal exercise, normal eating, their body's just not prepared to burn all that fuel. So they tend to gain weight. Also, if you're fasting, not intermittent fasting, but long-term fasting or just very, very low calorie dieting, your brain is going to sense that as starvation. And during times of starvation, it's a fantastic adaptation to lower the metabolic rate so that you don't burn energy that you don't have, right? So that your body spares that fat. So, it's not a great idea to do yo-yo dieting or to fast for very long periods of time. I'm talking, a week. And then again, environmental toxins can damage thyroid, can interfere with the function. Toxic metals are a big part of that generally. Which again, if we've really worked on your thyroid and we're not moving too far, that's one of the later things I look at, is to look at toxic metals, and we can measure that. There's testing, you can measure that through urine. So we can see if that's a factor for you. Okay, there's a lot of things that interfere with thyroid. That's why it's such a prevalent problem. So here's another slide, more things. Goitrogen. I don't know if you've heard of this term before, but a goiter is, a growth where the thyroid expands in size. It's very active. It's trying very hard to make thyroid hormone. And it expands and gets really enlarged. And you'll see people with a, kind of a swollen or puffy area right here around their thyroid gland. So a goiter is a big swelling of the thyroid gland. So foods that are goitrogenic can cause that, or at least interfere with thyroid functioning. We love brassica vegetables. We never want to talk badly about brassica vegetables because, broccoli, Brussels sprouts, collard greens, all these things, they're great for us. And they're really good for hormonal balance in women. So we don't want to avoid brassica foods. But if you've got a thyroid problem, you may want to avoid raw brassica foods. You don't want raw broccoli. Definitely cook it before you eat it. So those are some of the foods that can interfere with thyroid function in some, in people that are having thyroid problems, we really want to be mindful of this, but generally speaking, if you want to avoid a problem with it, cook most of your cabbage products. Soybeans and millet, these are two, a grain and a legume that we don't lose the compounds that interfere with thyroid function, even with cooking. So again, if you have a problem with thyroid, you really want to avoid soy and soybeans just because of this factor, because cooking doesn't even make them safe. Medications, there are a lot of medications that cause this. But one thing that's very common, and unless you're drinking water where you've got a reverse osmosis, that's really the only one that takes fluoride out. If you're getting regular fluoride through your drinking water, it's not great for thyroid. It can interfere with the uptake of the minerals that the thyroid needs in order to make hormone. So, obviously you're adults, you're not swallowing your toothpaste, you're probably not eating fluoride, but one sneaky place that it can be is in tea. Black tea, white tea, green tea, doesn't matter. They all come from the same plant called Camellia sinensis. And that Camellia sinensis plant, I can't think of the word. Anyway, it absorbs and puts a lot of fluoride into its leaves. It sort of sequesters that harmful substance and puts it in its leaves. So when you drink tea, you're getting some fluoride in there. So be mindful not to consume too much tea throughout the day. Okay. You know what? My computer is telling me that the battery is low, and I didn't expect that. So give me a second. I'm going to switch locations and get to where I have a power cord. All right. Sorry, the light's not as pretty here. Okay. So these are things that we can avoid so that they don't interfere with our thyroid function, right? Or just knowing that if you cook broccoli, if you cook cabbage, that's okay. And just generally speaking, if your liver function isn't good, that can mess up your thyroid too, because there are a lot of proteins that your liver makes that are important for the thyroid to function well. All right. Next topic is, how do we know? You may have a lot of the symptoms from that earlier slide, right? You may be gaining weight unexpectedly, can't lose it, you feel chilly, your hands and feet are cold, your hair is thinning. And we can think, well, likely this might be low thyroid, but there are a lot of conditions that can cause similar symptoms to this. So we're going to look and see some blood testing. So blood tests are really the best way to go. I know there are saliva tests out these days that can check some hormone levels, but they're not really as accurate, and they don't directly compare against the older studies we have. So really blood tests are the gold standard. They're the way to go. Like I said before, maybe your doctors have looked at your thyroid levels before and said, oh, they look fine, they look normal. Well, I don't care personally when I'm evaluating for thyroid levels. I don't care if it's in the normal range or not. I want it to be in the optimum range. And that's, something that I know from study. And I actually, when I review labs with you, I've got a sheet where I put my optimums down so we can compare them without just relying on that old standard range. Okay. We're going to be evaluating blood testing because that's really going to confirm for us that the thyroid is low. But it's also based very heavily on your functioning, how you're feeling. All right. So if you're recognizing yourself here and thinking, yes, or you've been tested before and you know for sure you do have low thyroid function, what do we do? Again, this is where our naturopathic principles really come into play. Always, we're treating the root cause. Yes, it may just feel better for us to give you supplemental thyroid hormone and send you on your way, and now your thyroid gland isn't making the hormones anymore, but you're taking a pill. Fine, that's a very easy solution, but it's not addressing why is your thyroid low. If it's autoimmune, we have protocols to address that. If it's lifestyle, of course, we've got things to manage that. Nutritional, so whatever the reason, we need to first find the reason, so that's what we're treating, rather than just taking the symptoms away and making you feel better, but not actually improving the function of your body. So yeah, so we can look into a low nutrient status, right? For one, we can just, sit down together and evaluate your diet. That's one thing um, I'm very comfortable with, and I feel very confident doing. My undergrad major before I went to medical school was dietetics. Nutrition is a main subject of interest of mine. So, we can sit and talk about your diet and just kind of get an idea if what you're doing is providing the nutrients you need. And if we're on the fence about that, we can definitely do that blood test I told you about earlier, where we can check to see yours. If you are low on certain nutrients, we can just have you supplement those specific things. There are also um, multi combination products like this thyroid support complex from Pure Encapsulations. I love that product. It's got a lot of the nutrients that the thyroid needs to support it. So there are, no end to supplements that we can use for you. Then if you maybe you have, say it's autoimmune hypothyroidism generally requires that we give you some hormone replacement because your gland isn't up to speed. It's not functioning and producing correctly. But we can definitely do thyroid hormone replacement. There are many, many products. Um, we have one that we historically naturopaths have really loved called Thyroid, but it is off the market right now. We don't know if we're getting that one back. But if you have used that one or used it in the past and really liked it, there are other options. There are a couple other brands that we can use other than just Thyroid to help with this. So some of them will have only the T3 hormones, some will have only the T4 hormone. Depending on what you're low in, you may need one or the other, or you may need both. And yeah, so there are many, many options to get this hormone back in you, and get your levels up if you're not making it well yourself. Um, Remember, toxic metals, heavy metals are something that can interfere with thyroid functioning. And that's something, again, we can test for it. But when we're trying to remove those from the body, one thing that can be very helpful is chlorophyll, right? It's the green stuff in plant leaves. So liquid chlorophyll is just a really, really concentrated amount of the green stuff out of plant leaves. And it helps to bind the toxic metals so that we can eliminate them through our bowels and through our kidneys. So yes, these are some of the things that we can add that will help supplementally. I can't leave you with talking about thyroid without mentioning adrenals too. Because remember how I talked about the hypothalamus deep in your brain, then there's the pituitary, and then the thyroid gland? We also have the same system where it's our hypothalamus telling our pituitary what to tell our adrenal glands. And those are in the back. Those are right on top of your kidneys. Those little adrenal glands are your stress management glands. That is what your brain uses to tell your body if it's in a stress state or not. And so that is kind of the interface between our stress and thyroid function. So we want to always make sure that the adrenals and the system of, hypothalamus, pituitary, adrenals, there's a feedback loop. We want to make sure that feedback loop is running well, because, if we don't, it just really ties one hand behind our back to get those thyroid glands to work well again. So, and really important too, if if you're working with me or another doctor, just know that if you're feeling lousy and tired and miserable, and you decide that a course of thyroid supplementation is a good idea, if you start taking thyroid hormone and instead of feeling more energized, you feel more depleted and more tired, it's likely because your adrenals weren't addressed. Because if you try to stimulate your body with thyroid, but your adrenals can't support that action, it just makes you feel worse. So a little complex there. All right. Well, my job here, though, is to just, help you to feel your best and help you to be energized and live the life that you want, right? If you have low energy and that's keeping you from, spending time with your kids or, well, I was gonna say your family, but that's tough these days. Or if it's stopping you from, doing that volunteer service work that you like, or traveling, or whatever are the important things for you to do with your life. If you're missing out on those because your energy is just not supportive of you, I'm here to help. That's what all of the doctors here at Living Wellness are here to help you, just so you can live the life you want to live and not feel fatigued and tired all the time. So some of the tests that we would run first thing to evaluate thyroid would be TSH, free T3, free T4, and the antibodies to see if you've got those going. If you have those done by other doctors and you can bring them in to us at your first visit, that's helpful. If not, we'll do them here. Um, that's really all that I have for a presentation. As far as my slides, we're done with those. So I will open up to questions if anybody has anything specific they want to ask about thyroid. Sorry. All right. I'm not seeing any questions. I'll give it a minute in case somebody's having technical difficulties. Okay. Hi, Marina. So Marina is asking, what if only the antibody number is high? Um, that's a good situation that you find it when you can sense the auto antibodies, but you are not yet seeing a dysfunction in your thyroid, because you can catch it before it actually changes. Antibodies, autoimmunity, especially autoimmunity against our thyroid gland, is often stimulated by problems with our intestines, problems with our digestive tract. So if we don't have a healthy gut microbiome, um, our gut microbiome, which is the bacteria that live in our gut, right? Those train our immune system. So all of those healthy gut bacteria are telling our immune system what is friend and what is foe. And when that is off, we can start directing our immunity against our own bodies. And very often with thyroid autoimmunity, the trigger that sets that whole thing in motion is gluten. Unfortunately, gluten is a trigger for people who are sensitive, to where it will throw their bodies into be attacking autoimmune against their thyroid gland. So, diet, gut health, really important to address when we've got that autoimmunity started again. Oh, you want to see okay. Somebody wants to see the first slide again. And unfortunately, we have to go through the whole thing to do that. But yeah, we'll go backwards. Alternatives to levothyroxine. Okay, yes. So Kara, alternatives to levothyroxine, that is only T4. So levothyroxine is a T4 only form of thyroid supplementation. It is bioidentical. So even though it's synthetic, meaning it was synthesized and made in a laboratory, it is bioidentical, meaning it looks just like these. This T4 that's right here on the screen right now, levothyroxine looks just like that. So your body recognizes it as something that it can use naturally. So alternatives to that, you can do, well, there's a few different types of T4 that you can take. I don't know if you're wanting an alternative to levothyroxine that's just T4, but some people also feel better when they have the T4 and T3 together. And in that case, products like, Nature Thyroid's off the market. So otherwise, it's Armor Thyroid or NP Thyroid. Those are good alternatives that we use very commonly here. Lorraine, new thyroid replacement drugs being developed always. Drug makers are always going to make something that is needed. So I'm sure there are a lot of options right now. So I don't know what you're looking for with that question, but there are definitely drugs being developed. Valerie's asking, if you have autoimmune hypothyroid, will you require supplements for the remainder of your life? You're not always increasing in dose or dependence on it. So dependence, when we think of dependence, I don't know in what your mind does, but when I think dependence, I think like opiates. We become dependent, right? This is something our body is going to need and need more and more. It's not like that. Your body is dependent on thyroid right now. It has been since the moment you were born, right? You are dependent on thyroid. So you will always be. If your body isn't making it well, then you're going to need to take something supplementally to help with that. And, it's just, I don't know, it's like if you didn't have a left hand, you'd probably use a prosthesis, right? It's something your body should have that it's not able to make because of the autoimmunity. So you're going to want to take a supplement of it probably forever. But really, the key with the autoimmune is to address that underlying cause of gut health. Connection with low thyroid and dry sinuses. Carmen, I don't know about that. Nothing's really ringing a bell with thyroid and dry sinuses. Sorry, I can't wrap my mind around what the connection could be there. Let's see. Jerry is asking about, oh, okay. So Jerry, you say your T4 and TSH are normal, but T3 is low. That, depending, I'd have to know you more. We'd have to talk about like your lifestyle, your history and all of that. But generally speaking, you remember when I talked earlier about female brain always wanting to protect the body from overexertion, overuse. Really, it wants to protect our fat stores. I mean, that's what it's about. Our brain wants to protect our fat stores so that we always have a buffer. Now, if you're overstressed, if your system is overstressed, whether it's mental, emotional stress, physical stress, or whether it's chronic pain as a stress or lack of sleep, those are big stressors. When our body is overly stressed out, it will intentionally lower the conversion of T4 into T3. So it will downregulate T3 production to slow you down. So I see that really frequently in patients where, their T4 looks great, but their T3 is very low. And really, we would need to work on some lifestyle adjustments or figure out what for you exactly is causing that. But it's not, again, our bodies are really amazing and make a lot of adjustments and adaptations. And that's just an adaptation of your body to the environment it's in. So, you could work on just finding out what it is that's causing that. Or, if you've done all that and it's still low, continues to be low, there are nutrients that can help with that, very specific nutrients, and that thyroid support complex that I listed in the slides. Or you can just take T3 supplemental hormone directly. So there are a lot of different things to do about that. But the root cause, always thinking about the root cause. Why is it that way? Oh, second slide. Okay, hold on. Kim, this is the first slide. This is the second. I think maybe you want this one. You just let me know. Oh, Kathleen, you want to know about gut microbiome if you're taking antibiotics. Okay, all right. Well, really, if you're anytime any of you take antibiotics for any reason whatsoever, you should do probiotic replacement, right? You should do supplementation with probiotics. So when you do one round, just for instance, one round of an antibiotic, your gut microbiome will take 3 to 6 months to rebuild from that one round of antibiotics. So you want to do probably 50 billion to 100 billion CFUs of a good gut probiotic for 3 to 6 months after you take your antibiotics, for sure. You also, it's not just enough to take the probiotic bacteria, right? Just taking them in, that gets them into your intestines, but you need to feed them, right? You need to make sure that every day you're feeding them what they need so that they can thrive. And that's fiber, dietary fiber. So, your gut health is really reliant on you eating good amounts of fiber every day. If you are somebody who can't tolerate fiber, you have one bowl of chili and you're blowing up and you're gassy and uncomfortable. That's a different condition, actually. That's not normal. It's very common, but you should be able to eat fiber without having your belly blow up and get really painful. So if that's the problem, there's a whole other thing we'd need to look into for that. But yeah, basically, take the probiotics, eat fiber every day, keep your gut on track. And pain medication is rough because oftentimes they're opiates, and opiates slow your digestive tract and they cause it to sort of stop moving. which hopefully you wouldn't have to be on those pain meds for too long. All right. I think I've answered all your questions. You had some good ones here. And, if you just need more direct assessment, right? This is so individualized, this type of care. We really need to know about who you are and what your habits are and what you eat and what you do. So, general answers aren't so helpful. I'm sorry, I can't give you really specific information like that, but hopefully you've got a good idea. If you want to come in and talk to me, or if you've got another doctor you're seeing, you at least kind of know where to start the conversation. But yeah, our thyroid is really important, and it's really, like I said, it's that little canary in the coal mine, and all sorts of toxins interfere with it. So just try to eat clean and sleep every night, please, ladies. Sleep every night, 7 to 8 hours. All right. I guess I'm going to wrap it up with that, you guys. Thank you so much for being here. There's going to be a handout that's distributed a little bit later. We'll send that out to all of you, just with some of this information written down. And also, I want you to know that Dr. Turner is going to do our webinar in February. And because February is Heart Health Month, she's going to do a webinar that's all about men and women's heart health. So that's going to be a really good one. Just watch our newsletter for the date of that one. But thank you so much for being here, and have a great weekend, everybody. I'm going to let you go now. Bye.